au rendez-vous avec. Okay. Okay. Oh, yes, come on in. Hello, my name is Gabrielle. I will be conducting your assessment today. Welcome to Sensetek Laboratories. Here at Sensetek, our mission is to broaden our understanding of the human mind through innovative training and assessment. Yes, I understand today you're here for a synesthesia exam. Is that correct? Okay. Do you have an understanding of what synesthesia is? Yes? Yes, exactly. Synesthesia is the term for when you experience one of your senses through another. So an example would be if you hear the number 3 and you think of a certain color, or you taste a certain sound. Yes. It's believed that less than 2% of the human population experience synesthesia, and it is also true it is not a disorder or something that needs to be treated. It just makes you very unique and special. Yes. Here at Sensetek, we believe that everybody has the capability of experiencing synesthesia at different levels. It is just something that you have to practice and train your mind to be able to really, really encourage the synesthesia. Yes. Alors, so today, the synesthesia assessment is divided into 3 parts. We have the questionnaire, then we have the physical exam that is commonly referred to as a cranial nerve exam, but it is a little bit more simple. It is not as elaborate as other cranial nerve exams. And then we finish with the SSE. The SSE is called the Sensetek Synesthesia exam. Yes, it's an acronym for that. Forgive me of any noises you hear here in the city. Of course, you're going to hear a lot of traffic sounds. We tried to keep it quiet, though, to focus on the assessment. Excellent. Do you have any questions before we get started? No? Okay. Your name? Okay. And your email address. Can you spell that out, please? Merci. Okay. And your phone number? With the area code. Excellent. Your address. Is that an apartment? No. Okay. Your postal code or your zip code? Okay. Your age? Okay. Date of birth? Okay. And your gender? Okay, and your pronouns. Okay, thank you. Your height? Okay, and your weight. Any pre-existing medical conditions? Okay. Are you medicated for that? What do you take? Your medications? Okay. Do you have any other prescriptions? Any allergies? Mm-hmm. Okay. All right. Have you ever experienced a concussion? No? Have you ever gone any general anesthetic? Okay. And lastly, do you experience any vision loss? No. Okay. You do wear glasses when you're reading, okay. Excellent. And you consent on being touched today. There are parts of the exam that will require some light physical touch, but I will ask permission before I do so. And if ever you are uncomfortable with any of our anything that happens today, please stop me and we will change what we are doing. There's many ways we can conduct the exam that do not require physical touch. Okay, excellent. All right, So we have inputted your information into the system. So for this part of the exam, we will ask some more specific questions regarding your synesthesia and how it may be affecting your day-to-day life. Okay. Do you have any of the following neurodivergences? So a neurodiversité refers to the variation of the human brain regarding sociability, learning, attention, mood, and other mental functions. Dyslexia, dyspraxia, ADHD or ADD, or autism, or none of the above. Do you experience any of those? Okay. Do you perceive numbers, letters, or words as color? So for example, the letter A may seem to you in your head as the color red, or the word Monday, lundi, may appear to you in your head as the color yellow. Okay. Is that no, sometimes, frequently, or almost always? Okay. Do certain sounds produce an odor or a taste in your mouth? For example, a particular word might taste salty to you. No, sometimes, frequently, or almost always. Okay. Do you feel physical sensations when watching someone else get hurt? No, sometimes, frequently, or almost always. Do you perceive colors or abstract shapes during everyday activities like eating? No, sometimes, frequently, or almost always. Okay. Do you describe your unusual perceptions to other people? Do you explain how color makes you feel, for example? No, sometimes, frequently, or almost always. Does hearing music produce an experience of color to you? For example, the note middle C on the piano, it might appear to be the color green to you. Or a certain tone you see color, like a song. Okay. Do you see numbers, days, etc. in a spatial landscape or pattern around the body? So when you hear certain things or when you see numbers or certain words, do you physically see things around the body? Okay. No, sometimes, frequently, or almost always. Have you been affected by visual distractions? Example, sounds cause colors that block your view of a screen or a board with information on it. So you may hear something and then it causes the color to obstruct your view. Therefore, you're seeing the color in physical space. Does that ever experience happen to you? No, sometimes, frequently, or almost always. Are you affected by visual confusion? Example, you confuse numbers and colors when doing sums or other calculations. This can happen when people experience color with numbers, and when they're trying to do the equation in their head, they may get confused because they see too many things visually. Okay, is that no, sometimes, frequently, or almost always? Do you have difficulty in a work environment? Example, you see information in the wrong colors. It confuses you. No, sometimes, frequently, or almost always. Okay. Do you experience pain when witnessing others in distress? No, sometimes, frequently, or almost always. Okay. Do you have any repetitive behaviors, such as fixed repetitive routines or an urge to check things repeatedly? Repetitive behaviors include repetitive movements with objects, repeated body movements such as rocking or hand flapping, ritualistic behavior. No, sometimes, frequently, or almost always. Okay. Do you see colored auras around people? So an aura is normally perceived as an oval-shaped area around a person, and sometimes vibrations or textures can appear as well. Okay, is that no, sometimes, frequently, or almost always? Okay. Do taste elicit colors or textures for you? Have you associated certain taste with certain colors? No, sometimes, frequently, or almost always. Do you have strong interest in visual arts or music? Okay. Excellent, thank you. That concludes our questionnaire. Yes. And now we will be moving forward into their physical exam, also known as a cranial nerve exam. But this will be a toned down version, less complex, of a regular cranial nerve exam. Alright, so the first thing I'm going to do is to wiggle test. So I'm going to take my finger and I'm going to wiggle either on this side or on this side. I want you to focus on my nose and I want you to tell me quel side, quel côté do you see the movement, okay? Is it right or left? Okay, so just focus on my nose and you tell me quel côté, which side. Okay. 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 Mm-hmm. 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 Yes, please. Keep looking at my nose. Excellent, thank you. Alright, do you feel any numbness on your face? Is it okay if I touch? Okay, thank you. Alright, let me just... Do you feel this on this side of your cheek? Do you feel this? Okay. And do you feel up here on the top of your head? Okay. And your chin? Okay. Excellent, thank you. Alright, I'm going to ask you to close your eyes. I want you to force to keep them closed. I'm going to try to open them, okay? Yes, try to keep them closed. Okay, perfect, thank you. I want you to wrinkle your forehead, like this. Wrinkle, okay. I'm going to try to force against it. Okay, thank you. Can you show me your teeth? Make a grimace, grr. Yes, like that, okay. Alright. And can you show me your tongue? Ah, stick out your tongue. Thank you. Say ah. Okay, just a moment here. Can you open your mouth, please? Okay. Excellent. Okay. Can you say ah again, please? Okay. Let me see. Okay, thank you. Can you clench your teeth? Again. Okay. Alright. Thank you. Alright, I'm going to make a sound on either side of your head and I want you to tell me what side you hear it on. Okay? Thank you. Close your eyes, please. Okay. Merci. Thank you. Can you shrug your shoulders? Okay. I'm going to try to force them down and you try to force them up. Okay, thank you. Can you turn your head right and left, please? Thank you. And can you throw your head back as far as it can go? And then can you touch your chest with your chin? Okay, just gonna stand back. Can you do that again, please? And face the wall. Thank you. I just want to get a good view of your flexibility. Okay. Thank you. All right, I'm going to ask you to keep your eyes closed and touch your nose with your finger. So close your eyes and touch your nose. Okay, thank you. This time I'm going to ask you to touch your nose and then touch my finger and then keep doing it as I move my finger. Okay? So just do this and then touch my finger. Okay. Okay, that's enough. Thank you. Okay, I want you to stare ahead, so stare at me and don't move while I touch your face, okay? I'm just checking the elasticity in your skin to see if there's any areas of concern with your face. Okay. All right. Okay, the temperature. Okay, merci, thank you. So for this part of the test, I'm going to go ahead and touch you with either a blunt object. So you see here, this is just a, it's very smooth. It does not hurt. It's rounded at the tip here. I will also touch you with this here. As you can see, it's a little bit pointier. It does not hurt. It's not sharp, you see. Okay. You tell me what you feel. So close your eyes. You tell me if it's the blunt or the sharp. Thank you. Okay. Okay. Mm-hmm. 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 Okay, thank you. Yes, keep closing your eyes. Thank you. All right. Can I see your hand? Excellent, thank you. Yep, just rest it here on my hand. I will do the same thing. You close your eyes. You tell me if you feel blunt or the sharp. Okay. Mm-hmm. Mm-hmm. Okay. Thank you. That concludes that portion of the test. Okay, excellent. And finally, we will end the physical exam with me testing and inspecting your aura to see if everything is okay and if you can feel certain things. Is that all right? I'm going to use a couple of my tools for this part of the exam. All right, I ask you to relax. Take a deep breath, hold it for 4 seconds, and then breathe out. Thank you. Okay, I want you to focus on being calm. Let your mind wander, okay? I know it's a bit difficult with because we're in a clinical environment, but I ask you to try to relax the best you can, okay? I'm just going to be touching at your aura. I will not be physically touching you in any way, but I will be evaluating your aura and plucking a little bit aura just to check your energy. Is that all right? Okay, thank you. Okay. I'm just going to pluck some of the negative parts that are surrounding your aura that's making it a bit foggy and hard for me to get a good view of, if that's all right. Thank you. Yes, just like auras, they get these visual blocks that are a lot like thorns, and you just need to pull them out to let the energy breathe through and to fix the circulation. Yes, okay. bit of a stubborn one there. Yes. Okay. All right. Okay. Oh, it's feeling much better. There's still a little bit more of refinement I must do, so I'll get a smaller tool if that's all right. Okay. Okay. All right, excellent. Oh, it's getting much better. I'm seeing a much better view here of your aura. Okay. Perfect, that's much better. Okay. Yes, your aura is much fluffier now. Lots of breathing room. Beautiful. Wow. Your aura is magnifique. Yes. All right. Okay. I will let that be. We will move on. Thank you. Excellent. Okay, so next we move on to the SSE, the Sensetek Synesthesia exam. Are you ready? Do you have any questions? Okay. If ever you do, just stop me and we will go over everything. No problem. Okay. What I'm going to do, this is the color card test. I will show you cards. You tell me quelle couleur, so what color you see. And if you associate it with anything, if you smell anything, if you see anything other visually, if you see, taste something in your mouth, okay. If you hear a sound, you say. If you feel something, okay. What color? Okay. Do you feel anything? Okay. What color do you see? Do you taste anything? Okay. Do you hear any sounds? Okay. Do you smell anything? Okay. Can you describe that, please? Okay. Do you smell anything? Do you hear anything? Do you hear a bell ring or anything of the sort? Okay. Do you associate this color with a specific word or number? Okay. Similar to the last one, but a different tone. Okay. Do you hear anything? Do you think of any words or numbers when you see this color? Do you taste anything in your mouth? Salty, bitter, umami? No? Okay. Next. Same question. Do you hear, smell, or taste anything when you see this color? And what color is it? Okay. Next. What color do you see? Does it evoke any taste, smell, sound to you? Can you describe that, please? Thank you. What color is this? Does it evoke any sound, smell, or taste to you? lastly, we have this here. What colors do you see? This one? Okay, and this one. Do you hear a melody with these two colors? Do you taste anything in your mouth? Do you hear anything? Do you see something else? Does it make you think of a certain word? Interesting. Yes. The two together create. Ah, okay. Excellent. Thank you. Okay. That concludes that first part. Moving on. Okay. I'm going to show you a number, some numéro, and I want you to tell me same thing. If you see a color in your head, do you visualize a certain color? When you see a number, do you think of a different word? Do you taste something in your mouth? Anything of the sort. Okay? What do you see? Okay. And what do you see here? Do any colors, do you associate this number with any colors? Okay. Any taste? Sounds? No? Okay. What about this shape here? Does that evoke anything to you? Different sense? Okay. Okay. What about this one? What number? Okay. And what number up here? It's a bit difficult to see, but you see. Does the number 0, does that affect anything to you? Do you see any color? Do you taste anything? Hear any sounds? Okay. Thank you. Moving on. You're doing great. Thank you. Merci. And what about this one? Does the numéro 5 bring up any smells to you or taste? Okay. Any sounds? Do you hear a ringing in your ears? A melody by chance? Okay. What about the triangle, the triangle up here? Yes. Does that make you think of anything? Oh, okay. Oh, that's funny. You associate the triangle with green, but you don't see green there. You see blue. Okay. Is that confusing to you? It can be because you associate a triangle with the color green, but here you see it is indicated in blue. That causes confusion to you. Yes, I understand how that can be complicated in your day-to-day life when you see things and they're not lining up in your head. I see. Okay. All right. The next one here. What number do you see? The big number. This one here. Yes, the number 8. And this number here? 2. Yes, 2. Okay. And do either of these numbers create any kind of smell, sense, or audible sensation to you? Not otherwise experienced? Okay. Excellent. Thank you very much. You're doing fantastic. Yes. Okay. Next, I have a few smell samples. I will ask you to smell the cards and I want you to tell me what it smells like and if it evokes any visual sensations to you, if you see anything, if you see color, if you see a word, if you taste anything, if you feel something, if any of these evoke a different sense to you, let me know. Okay, so the first one we have up is this one here. Can you please smell the card, please? Thank you. And what did that smell like? Sea salt, the ocean, yes. Did that evoke any sounds to you? Okay, any numbers or words to you when you smell this? Very fresh, like the ocean, yes. Okay. Right, next. Can you smell this card, please? Okay. Does this make you smell anything? Do you smell something? Yes, sweet. Okay. Chocolate? Yes, chocolate, you got it, it's chocolate. Okay. Do you think of anything when you smell chocolate? Do you associate the smell of chocolate with any words? Or does it evoke a different taste in your mouth? Okay. Next, we have this one here. Can you smell? Sniff, please. Yes, a green mint. Ah, okay. Oh, similar to the ocean, okay. Next, this is the last smell we have. Can you smell this, please? Again, okay. Yeah. Framboise. Raspberry. Yes, you got it, raspberry. Does that smell, does it create any taste in your mouth or any visual triggers? Anything of the sort? Okay. Yes, I understand. Thank you. Excellent. That concludes the smell test today. Next, we will continue on with the audio test. I will play a few different audio and you will tell me if you smell anything, or just like we've been doing so far, and you tell me if you see anything, or if you taste anything, or if you smell anything by hearing the audio I play. Some of these will be singular notes and some will be melodies for a more complex explication, okay? All right. Did you hear anything? Okay. Okay. Did you taste anything? Did you smell anything? Or did you see anything visually when you hear that sound, that note? Okay, I'll play a different one. That was la, the note la. Okay, something a little bit more complicated. You tell me if you see anything, if you taste, the same as usual. Okay. Yes, it's nice. Okay, interesting, yes. Like a symphony of colors you saw. That's fantastic. Okay, on continue, we continue. And how was that? Okay. Another, a lot of colors more sombre. Okay. So you saw like blues and some dark gray. Excellent. Okay, that concludes for the audio test. And finalement, we will do a very brief touch test. We've already conducted many of these in the physical exam, but we will go ahead and incorporate a couple of others just to wrap up the assessment. Is that okay? Excellent. Okay. I'm going to ask you to touch something. When you touch it, I want to tell me if you hear anything or if you experience any other senses, okay? All right. So go ahead and touch these. Do you hear any sound or associate that touch with anything? It is very cold, yes. Very hard, yes. Okay, not so much. Excellent, okay. And lastly, I'm going to go ahead and pinch myself like this, comme un petit pince. Did you feel that pinch? I pinch my skin. Do you feel it? Okay. Does it hurt you when I do this? Okay. Well, thank you. Merci. That concludes the SSE examination. So based on your results today, you have tested positive for projective synesthesia. Yes. So patients that test positive on the SSE, they are encouraged to take part in our additional clinical studies, alternative clinical studies. Yeah. So if you'd like to learn more, please fill out the additional study assessment form at reception on the first floor on the main level of the building. Yes, I will be in touch. I have your information and I will email you all of your examination paperwork, and based on my report, where your class fits and your level of synesthesia, and ways you can improve, and visit us again for further assessment. Okay. I'd like to thank you very much here at Sensetek. We appreciate your voluntary assessment. It is with people like you, through participating in the program, that we can learn and become better as an organization. Okay. Thank you for coming today.